To our ongoing coverage of the coronavirus pandemic, the Nigeria Center for Disease Control reported 1,024 new cases of Covid-19 overnight, taking the country's total number of confirmed cases to 100,087. And Lagos recorded the highest number of new cases with 653 new infections, followed by Plateau with 63 new cases. Borno State recorded 48 cases. And so far, 80,030 people have been discharged, while 1,358 people have died from COVID-19 complications. And joining me now to speak more about this public health is a public health expert, Dr. Nsiabasi Ekanem. Good to have you join us, Dr. Ekanem. Now, we have passed 100,000 confirmed cases in the country, and we're also now recording about 8 deaths every day for the past 3 days. Help us make sense of these figures.
Okay, thank you very much for having me. It's only unfortunate that at this time, when we felt that we have recovered to an extent from the COVID-19 pandemic, then came the second wave. What we are seeing now is not just a second wave, but a new variant of SARS-CoV-2. And from the preliminary investigation that has been carried out, we have come to realize that this new strain is more virulent. That means it can move from one person to the other faster than the other strain, the previous strain. And in addition, it is much, much deadlier. And that means that a lot of people who contract this new strain are likely going to come down with severe symptoms. And this is what we are seeing. Up to about 80% of those who have been infected with this new variant are already requiring hospitalization, and many of them are on ventilators. So for those who have COVID, we're already seeing fatality. So I think it's important for us to realize this and, gear up our response to this particular second wave so that we will not lose too many people.
All right, so talking about losing people, we're also getting reports that we're having more cases among young persons aged 21 to 50. And we're also now seeing a higher rate of deaths among young people. What is the implication of this?
Well, the implication now means that everyone is now really affected. Unlike the previous strain that affected basically people with who have come of old age, whose organ reserve capacity would have been low. This one is so much virulent that even young people, that have very, very strong immune system are equally as affected as the older ones. And that means that everyone needs to be on alert. We must not let down our guards. We must ensure that we strictly adhere to the public health precautions to prevent COVID-19. It's no more an option anymore. It's not an option for the older people alone. It is now compulsory for everyone, in the best interest of everyone. Everyone now can be affected, so we all need to make sure we adhere to these regulations. Stay off large gatherings, because we've observed that most of the people that are currently at the isolation centers are people that went to large gatherings, people that celebrated, the Christmas and the New Year. These are people that really came down. So we need to avoid large gatherings.
Allow me quickly jump in because of the points that you just raised. You said most of the cases we are seeing now are people who attended large gatherings or went to large gatherings. So at what point do you think, because over 100,000 cases and with the rate of death, at what point do you think that we should see some level of strict enforcement? And some people are already talking about maybe a lockdown in the country.
Well, given the nature of the environment that we are, I think a lockdown is necessary, because moving around the Lagos environment, you realize that a number of persons, if not all, people are not wearing their face masks, people are not even maintaining social distance. You see people are abusing these public health guidelines. And I feel in such situations like this, the only reasonable public health response is a lockdown. I think at this point, it might be necessary. But I am worried because the last lockdown really brought a lot of mayhem from security, from insecurity, to financial hardship. So I believe that if we can put our acts together, we should go on a lockdown and then ensure that Nigerians have what they need to remain on the lockdown, at least for the next 1 or 2 weeks, so that we can cut the chain of transmission of this new variant, which is much more deadlier and more virulent.
Public health expert Dr. Insi Abasi Kanem, thanks for talking to us.